Good afternoon, everyone, and welcome to our press conference to discuss the 2024 priorities for the Endometriosis Working Group. March is Endometriosis Awareness Month, and as those of us up here and on the Endometriosis Working Group know, endometriosis impacts 1 in 10 individuals in the United States, and yet it is still a very misunderstood, underdiagnosed, and under-researched disease. And so the Endometriosis Working Group was formed in 2021. We are a working group of legislators, of providers, of individuals impacted with endometriosis who come together to better learn about the disease and make recommendations for how we can improve conditions here in the state and across the country. And so this year's policy priorities include a number of things to continue to build on, but also some new priorities. One of our top priorities is to ensure equitable fertility care here in the state of Connecticut. We want to make sure that if someone is experiencing endometriosis, they can get the fertility care they need, regardless of their economic background or their gender identity. We also want to expand Connecticut's paid sick days legislation. Connecticut was one of the first states to enact paid sick days, but we have fallen woefully behind other states in that policy, and it would impact those experiencing endometriosis in the state of Connecticut. And we want to continue funding for the very important entity, the biorepository, which is now called EndoRise, that this working group really worked tirelessly on to get enacted here in the state. It's the first of its kind in the country, which will help lead Connecticut and other states in finding treatment and diagnosis for endometriosis. And so we have some additional policy recommendations that would be ongoing, including menstrual education for students, increased education through a school nurse program, as well as addressing women's pain and how it is often overlooked, ignored, and just women are made to feel like it's all in their head. And so we have an ongoing discussion here at the legislature on that work as well. So I am joined by some amazing community activists and members of the Endometriosis Working Group. And so without further ado, I want to invite up Shantana Hazel, who is the founder of Sister Girl Foundation.
Thank you.
Thank you.
Good morning. Thank you so much, Representative Gilchrist, for putting this together and also for forming the Endometriosis Working Group. My name is Shantana Hazel. I am the founder of the Sister Girl Foundation. We just celebrated 14 years in service for the state of Connecticut. And I wanted to share a little bit about my journey and why it's so important to make sure that we preserve fertility and we have coverage in that area. So I have endometriosis, and I have been living with it for over 30 plus years. I had a 14-year delay in my diagnosis, and that's because I was going from I had about 7 doctors who misdiagnosed me before I finally got the official diagnosis that I did have endometriosis. And no one spoke about my fertility, so I didn't have any knowledge of preserving my fertility. And so this working group and the work that's being done is very important because there's so many women that look like me that can mimic things that I'm saying today about going into our doctor's offices, not feeling heard, not feeling seen, and also just being misdiagnosed or having a delay in our diagnosis. And it's very detrimental to make sure that we have coverage. I remember I just spoke this past Thursday in regards to House Senate Bill, I believe it was 5240, correct? 5240 in regards to fertility coverage for Medicaid and Husky patients. And I remember that was me at one point because I couldn't work, because I didn't have I was missing so many days out of work, and it was hard to, and I was such a career person, but it was hard to maintain my employment because I was always missing days out of work, and I couldn't work because of just pain, agonizing, debilitating, and sometimes no one believed that that was really happening. And so now with the work that is being done, you'll have more patients, more students, and people just overall in the community who will have this information at their fingertips and will be able to get a diagnosis much earlier than 7 to 10 years, or seeing multiple providers. And also the fertility coverage. If you think about it, I've worked my entire life. I started working at the age of 14. And the funny thing is, I'm such a person that gives back in my community. And I have multiple degrees, but I didn't have coverage. And that was devastating. I couldn't continue my family building. And that was extremely devastating because no one ever gave me the information that I needed. So now no information, no coverage. And to date, many years later, I still have an impact of not being able to fulfill my family building. And so I just want to thank everyone for just being here and listening and being a part of the process. And Representative Gilchrist, thank you for inviting me to do this work. Thank you for inviting me to be a part and speak today. We accompany individuals to their appointments. There's not a lot of advocates out there, but there's a lot of advocates out there, if that makes sense. And so we're the patients, but we also have to rally around each other and reach out and make sure that we're taking care of everyone else at the same time. So 14 years of service, and that's advocacy, support, education, awareness, making sure doctors and healthcare facilities know what the patients in the community needs. So we're on the ground and we're actually hands-on with the patient. So the work that we're doing is very vital, and having spaces like this to be able to speak to that is beautiful. And it's Endometriosis Awareness Month. What better month than to talk about these issues and to actually bring about the change that we wanted to see for so long. But we have a long way to go, but this is a start of actionable steps. So thank you again for having me.
Great. Thank you so much. And thank you for sharing your experience and then using your experience to help others. And being here today is certainly going to help others. And as Shantana mentioned, her experience, unfortunately, is the experience of so many folks that they are misdiagnosed for 10, 14, 15 years, experience infertility. And it's so often the very individuals who experience endometriosis who are then doing the advocacy. And certainly we need that, but we also need others, in particular the medical community, which is why, again, we are so proud here in the state of Connecticut to have the partnership between UConn Health and Jackson Laboratory. And so I'm going to invite up Dr. Elise Courtois from Jackson Laboratory and Dr. Danielle Luciano from UConn Health.
Thank you, Representative Gilchrist. It is such an honor to be here and be a part of this endometriosis working group. And the fact that we passed the bill last year for this EndoRise program that will raise awareness and increase research and education and support for endometriosis patients like Shantana. I hear this story all the time. I am a gynecologic surgeon who specializes in advanced GYN diseases at UConn Health, consistent with endometriosis and uterine fibroids, abnormal uterine bleeding. And these patients often come to me just like Shantana after many, many years of being ignored and having terrible pain. And when they come to me, not only are they sad and frustrated, but they say to me, why can't I have everything in one space, And one of the things we talked about when we came up with this CT EndoRise program is to put everybody together, to bring the doctors and the advocates and the educators and the patients all together in one space so that we can all talk together. And this was all started by Representative Gilchrist, and it really is an honor to be a part of that. And I'm going to let Elise talk a little bit more about this program and some of the exciting advances that we have made since this bill has been passed.
Thank you, Danielle. So as Danielle mentioned, we started this program with Representative Gilchrist and the whole endometriosis working group. And we're really proud today to announce the launch of a CT EndoRise program. So it's really a groundbreaking initiative that is, as Representative Gilchrist mentioned, the first of its kind in the U.S. It's a public multi-institutional endometriosis program in the state of Connecticut that was founded to raise awareness, promote education of healthcare providers and medical students, and promote research efforts. So over the past month, we've been hard at work, and we built a dedicated team to tackle this disease head-on. And today we're thrilled to unveil the new website, ctendorise.org. It's a hub of information and support, and we will encourage you all to explore it. So here, we, physicians and researchers, will have access to essential biological samples and data to advance and gain a deeper understanding of this disease that we need really badly. It's a platform that is designed to facilitate significant strides in detection, treatment, and management of endometriosis. So we all welcome you to join us and be part of this endometriosis community, the research community, and the awareness community, because together we can make a difference. But our commitment doesn't stop here, and we are grateful for the full support that the legislature of Connecticut has provided and will hopefully continue providing through this legislation. We will support and we will continue to push boundaries, conduct research, and raise awareness about endometriosis until every voice is heard and every woman receives the support she deserves in Connecticut and beyond. So thank you, Representative. Thank you, members of the General Assembly and the public here today.
Thank you both so much. We are just so looking forward to seeing what we can accomplish here in the state of Connecticut. Another conversation we often have at the endometriosis working group is we need to start younger, right? We need young women to understand what's going on with their bodies so that when they're told something like, that's just normal to have that pain, they know it's not, and that's a sign of something potentially wrong. And so happy to invite up Jenny Cole from the Diaper Bank of Connecticut, who has done tremendous work in this state to address menstrual equity and is continuing to lead that work.
Thank you, Representative Gilchrist. Good morning, everybody. My name is Jenny Cole, and I'm the Advocacy and Outreach Coordinator at the Diaper Bank of Connecticut. We are a statewide organization that promotes access to infant and toddler diapers, period supplies, and continence products for all ages through direct distribution, raising community awareness, and policy advocacy. I want to thank Representative Gilchrist and the members of the Connecticut Endometriosis Working Group for all of the important work to create greater awareness and expand access to care. The Diaper Bank is proud to support all of the group's work and is grateful that the group has made increased menstrual education a very important topic. Through our period supply program, we work directly with women and menstruators ages ranging from 12 to older adults from all across the state. One of the most overwhelming themes we hear from these conversations is how ill-prepared and uninformed these menstruators feel about managing their own menstrual cycles. Menstruators are looking for a more in-depth learning. According to the State of the Period 2023 commissioned by Thanks and Period, 81% of U.S. teenagers believe that we need more in-depth menstrual education. And 78 believe that they are taught more about the biology of frogs than the biological female human body, which is crazy. By working in collaboration with the State Department of Education, local boards of ed, teachers, health educators, to establish and enact health education standards to include more in-depth learning about the menstrual cycle that is both age and grade appropriate, we believe that students will become active participants in their own health, maintain dignity and respect for fellow students as they grow up and develop, recognize menstrual abnormalities and disorders earlier on, such as endometriosis, and gain a better understanding of the various products needed and available. Women and all menstruators have a right to education regarding their bodies and their health. Thank you again to Representative Gilchrist and all of the members of the Connecticut Endometriosis Working Group. It's an honor to be included in this. Thanks.
Thank you so much, and thank you to those who spoke for the kind words. It is my privilege to get to serve as chair of the Endometriosis Working Group and learn from all of you on how best we can change things here in Connecticut and across the country. So as it is Endometriosis Awareness Month, we'll be pushing for these legislative priorities this session, but also be on the lookout for events and greater awareness throughout the rest of the month of March. Happy to answer any questions at this time. All right. Thank you so much.